Cardiac Rehab is an exercise program meant to get people moving and teach them about a heart-healthy lifestyle.
Pulmonary Rehab is a program of exercise and education. The exercise is more to give the patients some strength and endurance to get through their day, do their daily activities without shortness of breath or less shortness of breath.
The biggest way we try to talk to patients about what they should be doing if they're not wanting to do it is just kind of explaining the importance of it. You know, what are they wanting with the rest of their life is kind of the biggest things that we, try to encourage them and talk about their risk factors and what we can do to hopefully improve their life and if it means going for a walk 30 minutes a day and means that they can live a few more years, most people are willing to do that.
All the studies had shown that cardiac rehab is way better as outcome if you do it in the setting of monitoring and supervised nurses, whether they are fit to begin with or frail.
Well, on the first day, we've already given them hopefully a packet that is a number of assessments. It lets them kind of take a look at their life, how short of breath they feel on a daily basis, how their shortness of breath affects their quality of life. We also do a depression screening just to see how they're feeling about their shortness of breath, about their lung disease. From there, they come in with their assessments. We sit down together, we start looking at what kinds of goals they have for themselves. It's nothing that we push on them. It's all based on what kinds of things they would like to achieve, and we're basically there just to advise them through those things and get them feeling better.
First day here in Cardiac Rehab, we actually do more of an eval, where you meet one-on-one with one of the nurses, and we just talk about the program, set goals, and then we do a little baseline exercise, just so we know where we're starting, because everyone starts at a different level.
We're just kind of trying to build their strength back up to help them get through their day. We want them to learn how to be able to do activities without that shortness of breath that they've been experiencing.
Our open heart patients, we always say typically by the time they graduate, they're able to do exactly what they were able to do before surgery and then some.
I see where patients get to know each other, they have advice for each other on how they get through the day or how they prepare a meal that's easier or better for them.
So when you see those patients talking to each other also, they kind of like encourage each other.
It's great to watch them. They get to exercise side by side. We had two ladies that would be on the treadmill at the same time, then they'd go to the elliptical at the same time. They did everything together and they talked the entire time. We love seeing that. And it just makes exercise go much easier. It's just faster, speeds it up. To get to Cardiac Rehab, it's the back side of the hospital by the ER entrance 5. There's designated parking spots outside for Cardiac Rehab.
It's marked as Cardiac Rehab parking, but it's also for pulmonaries. They're absolutely welcome to park there also. From there, come on up to the second floor. There is an elevator available. Highly encourage you to use it unless you feel that your strength is such that you can use the stairs. But elevator is available. Get off the elevator and you'll see our gym.